So a lot of people are confused about the difference between stress and burnout. So I want to help clarify that for you. First off, burnout is a condition that is often a result of chronic stress. And burnout is really a combination of physical and psychological symptoms, including physical fatigue, emotional exhaustion, and a decreased sense of efficacy or accomplishment. So, if you're curious to know, are you just in stress or are you in burnout, you can take our free quiz to find out, what your risk factors are and where you are. So click the link in my bio or in the description, all right? But if we look at stress versus burnout, there are some key differences for you to know right off the bat. First off, stress is a situation where you are kind of overactive, you're irritable. Whereas by the time you get to burnout, you're disengaged and you're starting to feel numb. That's how far it's gone. The second thing is in stress, you've also got a lot of worry and anxiety. But by the time that turns into burnout, it's more like you're apathetic, cynical, okay? In stress, you tend to be, actively trying to fix things. You're a little bit frantic. Whereas by the time that gets all the way to burnout, you're feeling very discouraged and very unmotivated to try because, again, you feel like you're not even making a difference. Next up is in stress, we are often edgy and amped up and wired. We may be tired, but we feel wired and edgy. Whereas by the time that gets to burnout, you are physically and emotionally and mentally exhausted, just done. Next is mind racing. In stress, your mind is going, it's busy, it's racing. You have thoughts. Whereas by the time you get to burnout, you've got brain fog. Your mental function isn't working. Probably your memory, or at least short-term memory, is fried. The next thing about stress versus burnout is in stress, you are having trouble sleeping. You've got insomnia, or you're waking up extra early with your mind already going. Whereas when you get into burnout, you are either excessively sleeping, you're just completely gone, but you don't wake up feeling refreshed. So that's just some way for you to tease out the difference between being stressed and being fully in burnout. Again, if you want to find out if you are in burnout or are at risk for burnout, then take our free burnout quiz. In the coming months, you'll be able to take an in-depth assessment to really find out the level of stress and how it's impacting you and the level of burnout. And our Unlearn Burnout Assessment in partnership with Innate Vitality will also help you identify the risk factors. So there are psychological and emotional and behavioral traits that many of us have that actually make us susceptible to burnout. Because not everybody that's stressed, not everybody that works 40 or 50 hours a week burns out. But many of us do have emotional programs, mental structures, and coping strategies that make us more susceptible to burnout. And once you know what those are, you can modify those. Sometimes you can't modify your job or your caregiving role, but you can modify yourself. So stay tuned for that, all right? Now, many people will ask, okay, how do I recover from burnout? And the sad answer is, even if you were to go talk to your doctor, they are probably not going to have a good treatment plan for you. They'll probably tell you to take some time off, go for walks, try some yoga and meditation, which are all great. But the reality is most primary care doctors are not trained in burnout recovery. Burnout recovery actually happens in rehab hospitals. So fortunately, I've had experience there in many, many ways. And what we are doing at Innate Vitality and Unlearn is bringing my 3 keys to burnout recovery to the world so that you don't have to be hospitalized, you don't have to go into rehab. There are really 3 keys to recover from burnout, and I will be covering these in additional videos and podcasts. The 3 keys are these. The first one is to release. You've got to let go of the need to perform. You've actually got to release yourself from the burden of overdoing and overworking. And that involves a detox of your life and your brain. The second key is really to replenish the body's and the brain's building blocks. Because many of us, when we're stressed, when we are burnt out, we deplete our body's stores for recovering naturally. So brain neurotransmitters, as a result of the hormones and the cortisol, our blood sugar gets out of whack. So you need to rebuild the internal building blocks for vitality. And then key number 3 is to reset. This is where you unlearn the unhealthy coping strategies. This is where you relearn how to connect to your soul so that you are living in accordance with your values, setting up proper boundaries, and really focusing on building resilience. So the 3 keys that I've worked at in stress science and rehab hospitals are release, which is the letting go and detoxing your life of the things that are draining your brain. The second key is to replenish the body and the brain's building blocks. And the third key is to reset. And that is when you unlearn the unhealthy coping strategies and relearn how to live with resilience. I will cover those 3 keys individually, but I just wanted to give you this understanding of the difference between stress and burnout. Be sure to check us out at innatevitality.com, where you can read more articles in our magazine and watch interviews and our upcoming documentary film.